Assalamu alaikum. Good morning, everyone. My name is Asif Iqbal. I am a medical physicist from King Fahd Medical City. I am presenting the work of Mr. Abid Ali. He is the senior radiotherapist from Sultan Qaboos Comprehensive Cancer Care and Research Center. The topic of his study was position reproducibility testing for MR Isocenter using MR guided radiotherapy simulation protocols for head and neck by using the thermoplastic mask. This is the picture of the MR simulator which they are using at their center. The position reproducibility plays a prime role in MR only simulation of flow for the precision and efficiency of the delivery of the radiotherapy. As you know, everyone, the geometric efficiency of the isocenter should be accurate as planned. The objective of his study is to assess the position reproducibility of the Philips Ingenia Ambition 1.5 Tesla MR system using an MR radiotherapy simulation protocols for head and neck patients using this 5-point thermoplastic shell. This is the picture of his setup which he used for his study. It is showing clearly that there is a mobile couch which they used for this MR simulator. Mostly in the MR scanning, they use not flat this couch, but for the MR which we used for the radiotherapy purpose, it should be a flat panel, because for during the delivery of the patient, it is flat also surface, and this will be also a flat. They use a flat couch type. And this is a 5-point thermoplastic mask, and he used some rings, and there are, it's very clear also there are some the fiducial markers, and if you can see a little bit in the under the thermoplastic mask, he put a one bottle of the water. Actually, he did his study without the patient. Actually, he just used the mask of the patients, okay, to get the signals. I mean, for the MRI, it needs like a hydrogen, the atoms. Hydrogens mean they can come from the water. And that's why to enhance the image quality, to produce the image, to check this fiducial markers, he put a one bottle of the water in downside of the thermoplastic mask for his study. The maths is what he used, as I mentioned already, he used his data without the patients. He took the 18 patients which were already under treatment, the mask of these patients, then he put on the couch, and in the couch he has also this one flex D and L coils, anterior coils, fixed posterior coils, and as we know already, there should be also one laser system for our external like position for the tattoos which we use already in the city. This is the same setup which he used for the MRI. They have external laser system. We should put the patient on this one. We will mark with the tattoos. Then we will shift the patient in the isocenter of the MRI. Then he will scan from that area. Okay. Then he used the fiducial marker, which is also showing here. This fiducial marker, it is like more than 6 millimeter in size, diameter. Okay. And then he observed the variations in the positional reproducibility. His work was, let's suppose he first put the patient on the external lasers, then he shifted this on the isocenter, then he checked this variation. I mean, let's suppose if one person one day he did the one position, let's suppose put on the machine lasers, then he shift how much it is shift, and another person how much he is efficient to reproduce the same setup. Then he note this variation from the center, from the laser, the outer laser till the center, and then he noted this one variation, yeah, in his study. Okay, he used some rules or protocols for the image acquisition. Um, uh, in the diagnostic, the MR, they have some angulations for the images. Due to the angulation, it gives them a very good image quality. But for the MR guided radiotherapy simulators, there should be no angulation. Okay, and the whole treatment area should be, I mean, our field of view should be covering the target and the normal organs. Okay, and to get the better quality of the images, he used water fat shift parameter value less than 1 pixel. I mean, as we know already, to obtain any CT or MR image, we have some protocols, departmental protocols. He followed these protocols, and he put the geometric distortion correction to 3D, and the gap between slices was set to 0 for 2D slices. If 2D scans are used, use small field of view and stacked close to the magnetic isocenter. Okay, the challenges is which he faced for this his study. As I mentioned already, that he did not use the real patient. He just used the mask of these patients. And to obtain a good signals of the MRI, there should be some like hydrogen atoms, like water tissues. Our body is like a more water, like a water equivalent. Okay, and that's why he used only a bottle of the water. Due to this one, you can see in the pictures, he's just showing only the shape of the bottle. Okay, and it is showing also the fiducial markers only. But in his study, he was unable to get the structures. I mean, because there is no patient, there will be no structural anatomy, and the quality of his image was poor. And then the another thing which he has challenges, I mean, he used the fiducial marker which was greater than 6 millimeter. I mean, to accurately check the distance from the fiducial marker till the MRS center, mean mean this fiducial marker should be small. If it is bigger, then there are some also chances of error. Mean to go to the center of the fiducial marker, mean you should be very accurate. This is the center, this is like 3 millimeter, 3 millimeter. This is also his challenge in his study. Mean he used a bigger, large size the fiducial marker. And another thing, the scanning time for his MR, it was like more than 5 minutes. I mean it is more, it is too much, yeah, for the patient. Okay, then his results and finding was in the transversal plane, his standard deviation was 0.57 millimeter left to right and 0.45 mm from anterior to posterior. In the coronal plane, standard deviation was 0.57 millimeter left to right and 0.34 millimeter from head to feet. Okay, in the sagittal plane, standard deviation was 0.45 millimeter from anterior to posterior and 0.34 millimeter from head to feet. Okay, his data, he observed the ranges of the deviations. Okay, in the transversal plane, like left to right and anterior to posterior, coronal and sagittal, they were -1 millimeter to 1.3 millimeter and 0 millimeter to 0.6 millimeter for the transversal plane, and for the coronal -1.1 millimeter to 1.3 millimeter and -0.4 millimeter to 0.4 millimeter. And for the last sagittal plane, which was from like a it was -0.6 millimeter to 0.7 millimeter and 0.4 to 0.5 millimeter. You can see from his data, it was like within 2 millimeter, less than 2 millimeter. Mean the concern, as we also know that, mean if our variation is in shift is like a less than 2 millimeter, we accept the, yeah. But his variations were like less than 2 millimeter. It is around 1 millimeter to like little bit more. This was his results. And in the next slide, what he mentioned that the positional reproducibility has a great role for the MR guided radiotherapy. And with this one, if our position is accurate, if our setup is very accurate, then images will be also very perfect. And even for this one, it has also the positional reproducibility has a very great role for the treatment planning and monitoring. I mean, let's suppose if we do a plan on a, like we will receive a MR images or CT images. If we do a plan on them, and if the our plan is very perfect and all the parameters are very good, and if we cannot reproduce the same position, then there will be no benefit of the delivery. I mean, the organs at risk which you spared, they can get more dose because we are sparing like millimeters, the, like millimeters shift of the organs. I mean, if we our setup is not accurate, position is not reproducible, then there is no aim for the things here. The future directions and the conclusions. In this slide, he mentioned that because he used only 18 patients and the thermoplastic mask of 18 patients, the patients were not there. And he mentioned that there should be patients. We should do this study with the patients, and the sample size or the number of patients should be more. Then we will be more like we can see more deviation, and we can be very comfortable that we are now accurate in this thing. Yeah. Yes, thank you very much. Yeah, thanks a lot. Any questions? Yeah, please.